And do you have a primary care?
Yeah, Candace.
Nickel.
Candace Mickle?
Nickel.
Nickel, okay.
She's a PA.
Oh, okay. Is she down in
Northport.
Oh, okay. And let's see. Not allergic to anything, right?
Not yet.
Okay. Very good.
Except that plastic stuff you put over your injuries, so
Like on this port, they put some plastic stuff.
yeah.
Sometimes it's just the adhesive they use on those products that.
I get blistered with that for some reason.
And we are on Plavix because of
Heart attack.
okay. And we have cardiac stents, right?
Yeah.
Okay. And when was the last stent?
When was it, May last year?
I think so.
Okay. 5 of 2016. And who is your cardiologist?
Dr. Mula.
Okay. $132.74. Very good. Okay, so surgery started with a 2004 laparoscopic double inguinal hernia. Who did that? Was it Dr. Fitzgerald or somewhere else?
That was in Georgia, Dr. Chris, I think it was.
Okay. And did okay with that, right?
Yeah.
Okay. And that was Georgia.
Yeah.
Then 2006.
Yeah.
You were misdiagnosed.
Yep. With pancreatic cancer.
Okay.
So I went for a Whipple operation.
Mm-hmm.
And they didn't do it at Whipple because when they opened me up here and they looked, they didn't see any sign of cancer.
Okay.
So it was all a big waste.
Okay.
And then when what was it?
So that was in 2006.
Yeah.
Then, go ahead.
Fitzgerald, he opened back up again.
Okay.
Same scar.
Okay. Because
Cancer mass.
okay.
It grew right over my the valve where the food goes into the lower intestine. Grew right over there.
Okay.
So nothing would empty my stomach unless I threw it up.
Oh, so you were having you were sort of like a emergency. You were having a
right.
small bowel obstruction.
Yeah.
Right?
Mm-hmm.
Okay. So then you had
That went on for about 10 weeks before I had the operation.
Mm-hmm. Well, he kept getting misdiagnosed until we went to Sarasota Northport, and they ambulanced him to Sarasota here hospital.
okay. So then 2016. 6/27, 2016. Exploratory lab, bowel resection. mesenteric lymph.
In February, was that last year too, when I had that other heart attack? They messed up and gave me a.
They went in his groin and he got a pseudoaneurysm.
So,
Okay, so that's how. Okay, which groin was it?
this one here on
Right. Okay.
Yeah. And when we goes in through the wrist to do the other stents.
Okay. And let me see what kind of mesh you put in here. So did they have to do anything with the pseudoaneurysm?
They injected it with some formin, I think it was,
Okay.
you know, to stop the bleeding.
Uh-huh.
They like never got that thing straightened out. They tried 3 or 4 different things
Yeah.
and called in to 3 doctors. That was over in Port Charlotte, which we don't plan on going back to there ever.
So, what's going on with the treatment of the...
Well, apparently Dr. Fitzgerald's didn't hold, and it's resection. What do you call it? Eviscerated. Yeah.
Whatever that
Oh,
was.
okay. Okay.
And I have not done anything to make that thing.
Yeah, he hadn't done anything. And he wore that binder,
Yeah.
and everything.
Yeah, I couldn't do anything because I couldn't breathe when I got up.
Yeah.
I couldn't walk 200 feet.
They put him on oxygen and all kinds of things.
I seem to be doing a lot better with this band.
Okay.
We got a new one.
Yeah.
That's kind of wore out anyway.
It's a lot bigger.
So as far as medications, are you on any completed 12 cycles of Bullfox, right?
Yeah, I'm done with that.
Okay.
He did all his chemo,
Yeah.
and they've cleared him for
Yeah.
surgery on that.
Okay. So chemo and
Heart. And he'll clear
He's
me.
having a stress test Friday at Mooner's office, and then if all goes well there, he said then he'd call y'all and clear him as well.
okay.
And I had an echo done in March.
No,
Yeah.
it was just it wasn't that long ago. But they said that was fine, and
Yeah.
that he'll send all that over after he does the stress test Friday to here.
We think the pseudoaneurysm was in 16, right?
Yeah,
Okay.
February.
Okay. So immediately after surgery, did it just open up?
But it was before they finished and everything, because they had a hard time getting pulling all that stuff out.
Okay.
And they had to get some big guy from down in the emergency room to come up there to pull it out because the nurse had
You're talking about the one that's putting the stent in.
Yeah, they're doing it after they got to doing the stents.
Oh, okay.
Is that what?
Oh, no, I was talking about your hernia.
Oh.
After Dr. Fitzgerald repaired it.
Yeah.
Did you have a wound issue? Did it just completely open up, or?
Well, it didn't.
It didn't even do that. The drains were fine. We had a home nurse and everything. He didn't do anything.
Okay, no. But did you have? So after the drains came out,
Yeah.
Okay, and you had staples there.
Yeah.
Did any of the incision open up?
No.
The incision never opened up.
No.
Okay. Can I see, please?
That's what Fitzgerald said. He goes, what have you been doing? Nothing.
This side here has always been. I thought maybe it was still draining on this side because it pokes out more over here.
Oh, no, not draining. It's just where your abdominal wall muscles are not
Really
intact. Yeah. How's your weight been? Have you lost weight? Were you heavier? Or tell me.
Well, after my heart attack and everything, and then I, got through with that. I got real sick with the cancer thing.
He lost a lot of weight.
And it took about 8 weeks for them to find that, and I couldn't keep anything on my stomach. So I was not able to eat for those 8 weeks.
Okay.
And then spent another week in the hospital in Fawcett in Fort Charlotte. They couldn't find that. Didn't find that.
Okay.
So it was another 2 weeks from that. All this time I'm still not eating. So I lost about almost 40 pounds, close to 50.
Right. Okay.
And then I had the chemo, and I didn't gain a pound. I think I got down to 230 or something like that.
Okay. What was your highest weight when this all started?
Probably 265, 270.
Okay. And
But my stomach never did go down.
Gotcha.
Never lost anything on my stomach.
Okay.
Lost a lot of muscle weight.
Okay. And your son had a hernia. Was it down in his groin?
It's belly button.
His belly button.
Yeah, he still has an issue with that.
Uh-oh.
He's in Georgia.
Uh-oh. Did he get it repaired?
Not yet.
Not yet.
You better take a drive down here.
Yeah.
Well, he's supposed to in 2 weeks, but I guarantee he won't mind me anymore.
But that really bothers him. Well, never bothered me much.
Really? Okay.
Oh, I used to go hunting all day long, walking around, chasing bird dogs.
Okay. Well, let me pull up your CAT scan. I know Dr. Yunis already looked at it once because I remember Fitzgerald talking to him on the phone and, so. And she'll be in just a few. Okay, thank you.
That binder there, I'm not having that much, but I'm still short of breath even after with this one.
When you say you're short of breath, why are you so sure it's related to the hernia?
Well, because all this weight right there, I guess it matches on the lower part of my lungs. I can't really get enough of a breath.
Right.
For walking or anything.
Right, that's definitely a possibility. But I ask you that question in a funny way because it's hard to really know that for sure. Like, in other words, you're also saying one of your big complaints is you're short of breath.
Yes.
So have you had that looked into? Because really, even though you have this hernia, more common reasons are your heart or your lungs.
My cardiologist didn't think of that. And even after my 2 heart attacks, I was not out of breath like I am now. I didn't have this problem before.
So how long have you been so short of breath like this?
Since after this last
since the operation.
Yeah.
So Dr. Muma really thinks, you're sure that he thinks that your shortness of breath is coming from this hernia?
Well, we're going to have a stress test, right?
Right. I mean, have you had an echocardiogram? Meaning your ejection fraction is good? Do you know what I'm talking about?
Yeah.
That's fine?
Yeah, it's
Okay.
It's normal.
And then have you had a visit with, this is actually very important. I know you're here about your hernia.
Yeah.
But have you had a visit with a lung doctor?
Not since I've been down here, no.
Okay.
Well, who did you go to that put you on the oxygen?
Well, they did do a test at Sarasota on a lung function.
Well, what I'm getting at is that, you're having some discomfort, but right away you said shortness of breath, and I wasn't expecting that.
Yeah.
It's not common.
You're right.
Okay. So, I mean, it's not a common thing that it would be from this, especially because your hernia looks pretty loose.
Yeah.
So what I'm saying is it's really important for you to feel better, to make sure you know why. I mean, shortness of breath is annoying. It's very annoying. Yeah. I mean, I can imagine. And it's potentially a life-threatening problem. Well, that I think you should be 100% sure what your shortness of breath is coming from.
Oh, yeah.
And regardless of a test, what I'm leading to is you should spend the time or the effort to see a pulmonologist, a lung specialist.
Yeah. Well, it doesn't bother me sitting down. I have plenty of breath there. It's getting up and walking, standing.
I know, but that's
Still,
the problem. I still think that it's not from. I mean, I'm not positive. I mean, I'm going to examine you a little bit better, but it's rare to see a hernia that's as loose as yours cause shortness of breath. I cause shortness of breath, which is what I'm going to get to about why I can't fix you right now when I operate on a guy like you.
Yeah. I
can really give you shorter. I can put you on a ventilator for 3 months. I don't think your shortness of breath is from your abdomen. It's very important that you really find out why, so that you can A, maybe feel better, or B, optimize it, or C, we know about it, God forbid it make you worse with surgery. Right. Okay. So you live in Punta Gorda. Yeah. I'm sure there's very good doctors down there. The only lung doctors I can recommend are the ones up here.
Good, that's what we want.
So I'm going to really, I don't want to, and I know it's also, by the way, I know it's a hassle to go to doctors. Okay, you got to wait there, you got to fill out paperwork, it costs money, they order a bunch of tests, they don't say anything. You need to go to a lung doctor. Okay. And if the lung doctor's an idiot or doesn't treat you right, you need to go to another one. Meaning, it's very important that you figure out for sure what's causing this. So, you can feel better, so that we can know what it is so you don't die from it, and we know from it is so we don't do surgery and make it worse. Yeah. You just tell us who. Here, so that's right. Sarasota. So one of the things on the list will be, there's a group of doctors and they're all together, and so it's very easy for my secretary to make an appointment with one of them, we call them lung associates. I can't really give you an individual. And they're all excellent. Okay. But when I say idiot, meaning like sometimes maybe they're not so smart with you, or you think that they're not listening or something. Mm-hmm. It's that important that we find another one. Yeah. So we're going to try to make an appointment with lung associates. Their office is in this building right near here, and then we really need to do that. Okay. All right, that's fine. I looked at otherwise your history. You had a cancer of your small intestine, which is very unusual, but you're done with treatment, and at this point we think you're cured.
Yeah, well, I was cured after the surgery.
That's pretty good.
And none of it ever came back.
But you got chemotherapy.
Right. That's just as a
caution.
Right.
Mm-hmm. Yeah, an insurance policy they call it. Mm-hmm.
The last operation that Dr. Fitzgerald did was in June of 2016. Yeah. And your hernia came back right away, or how fast would you notice it came back?
Well, I didn't know it was a hernia.
We didn't know.
But my stomach just kept getting more and more big.
Right. And then, it's just not in here.
They just told him while he was having chemo he couldn't have it seen about.
And I started getting these lumps everywhere, even up here, as far as up here.
What lumps?
Well, you don't see it now, but right here, it's a herniated up here too.
Okay, let me see you do that with your muscles. You did that when you pushed out. I mean, that's just, I don't think that this is in your chest. So did you think there's a lump here too?
Well, this is what Fitzgerald said it was.
Stand up for me.
Well, you stick your fingers so far deep in there.
Yeah. And I saw your CAT scan. I spent a lot of time looking at it. and I have a good sense of it.
You don't think any of this is fluid or anything?
I know it's not.
Okay.
No, there's a tiny little bit of fluid around your liver.
Yeah.
Right? Wasn't that you that I just saw that on? Let me just make sure that they agree with that. Meaning we know that answer for sure from your CAT scan. So, no, there was no fluid. Right. No, yours was no fluid. So we know that for sure. This CAT scan that I looked at was from June.
This one we had when? Wasn't it long ago?
When he's looking at
Oh, no, I'm sorry. That was the comparison. I apologize. Meaning they make it very difficult to know the date of the CAT scan. Your CAT scan was from April 11th,
Okay, yeah.
2017. So that's very recent. And for sure, it showed no fluid in your abdomen.
Okay. It just seems so fluid to me.
That's right. I
Because
understand. You had a muscle before, now you don't.
Yeah.
Right.
And see, my muscle was, when they did that double inguinal, he couldn't believe how thick my muscle was. It was over 4 inches thick.
Right.
And when I had this other, pancreatic cancer scare they gave me, I went to India and had that done because I was in the middle of changing insurance and they called it pre-existing. So
you had to go to India for the surgery and pay cash.
Yeah.
But you went to India because it only cost you $10,000 instead of $100,000.
Well, it was 20,000.
It cost $20,000 still. In what year?
Well, I was there for over a month.
And it cost $20,000.
Yeah.
In 2008, I think I saw. Is that what it was?
6.
2006.
Yeah.
That's a lot of money in India.
It was either that, not at all.
So what now?
It was where the operation.
New Delhi.
And you went with him?
No, my daughter did. She's a nurse. So
and what was that like?
My daughter loved it. Him not so much.
Well, it's different people.
Yeah.
I mean, everything's different.
It's very different.
And
it's very different.
People think they're poor here. There's not a poor person in the United States.
Right, comparatively, yeah.
I mean, in the humanity, it's unbelievable. What is it? I think there's 20 million people in New Delhi. And it's about the size of Atlanta, the area. Right. And just driving back and forth.
That scared you, the driving.
They got 3 lanes marked. Nobody pays attention. There'll be 8 cars going down through there. And most of the cars' side mirrors are all knocked off. I saw, in the whole city there, we went all over it, I saw 2 traffic lights.
Interesting.
And they didn't pay attention to them.
There's 1 billion people there, yeah. 1 billion people there.
Our daughter wants to go back to this day.
So you stayed in a decent hotel, obviously.
Well, it was a hospital.
It was okay,
much.
yeah.
So she had a good time. She would help him go back and forth.
Yeah.
And she did some traveling around, I guess. With a few dollars, the point is you can eat pretty well. I mean, I wonder what was it that she enjoyed doing? What was it?
I don't know.
You know what I mean? Like, I want to go to India, yes. But I would think that she didn't have such a great time if she was stuck in that one city.
I did not want to get. Well, see, I'm sitting there. I had a hard enough time in the hospital because right after the operation, I was in a fight with. They didn't have room in the recovery room, so they stuck me in another room where this guy was dying, and his whole family was there. There must have been 70 people in the room, about twice as big as this. I mean, and all their beds are a lot shorter there, so my feet, and I had to be raised up like this because it.
And you were recovering.
Yeah,
right.
From the hospital, from the operation, and so I'd always slip my feet would slip through the bed there, and I'm sitting there on this medication like that, and I'm having this dream. I'm on the beach, and it's the silkiest sand in the world, and I'm sitting there, just doing my feet like that. I can't believe how silky this sand is like that. And somebody hollered out like that, and I woke up like that. And one of the women had her butt on my feet. And some of the men saw that, and tell you what, they really take it personal. So there's 3 of them that jumped on me. One of them was straddling me like it, jerking. I weighed 270 pounds, so and their arms ain't that big around, you know, they're trying to move me, and there's other people are shoving me, like that, I'm screaming for the nurse, painting, you know, and she don't come, like that. Finally, I had to reach up and just grab one of them, and I got him by the throat, and I jerked him down to my face. I said, no, like that. So they took off running.
As if you were doing something offensive on purpose.
Right.
Disgusting.
And
That's a scary experience.
That is.
Anyway, did you have major complications from the surgery? That's a dangerous operation.
No, I didn't.
So you did pretty well.
Yeah, and time to go home and start doing anything I wanted to.
And have you had any digestive problems that you would relate to the Whipple? Meaning you could have a good Whipple and still feel like you can't eat certain foods or whatever.
Well, you know, I always had, you know, lactose intolerance. Okay, so that's the only thing that's ever bothered me.
Right.
But as far as eating anything, once I started taking magnesium, I don't have any more kidney stones. I don't have any lactose intolerance.
I'm just looking at one thing I didn't see here. I apologize. I want to make sure completely cleared for surgery. So this is, the nurse, Rebecca Conway, is talking.
Yeah.
Yeah, no, basically they think that you have what we call no evidence of disease.
Yeah.
Okay, so you have a pretty, not the biggest hernia I'll see this week, and not the most complicated hernia I'll see maybe even today. Okay, so sometimes people like you that have really big hernias like this, you feel like this is crazy, you've never seen anything like this before, but the truth is what you have is very common. So let's start with that. And to cut to the chase, it's all about, at this point, it's all about your weight. You are not so terribly overweight. There are super obese people walking around that make you look like a skinny, you know, anorexic. But with a hernia like yours, which I'll get more into, the only way we're going to get a good result is for you to even get close to even ideal body weight, like dramatic weight loss is what you need. Okay, we're not talking 10 or 20 pounds.
Yeah.
And I'm going to explain why. First of all, you know, just to show you where you are with weight, that is true, because you're not so super obese. At 5'11", and I'm sure you used to be 6'1", I know, I'm aware of that.
6'1", yeah.
Right, or whatever, you know, we're all shrinking. Your ideal body weight is maybe 190 pounds, 185 pounds, okay? So literally, you're about 60 or 70 pounds overweight, okay? And that's a lot. So, what the hernia is a hole at this point in your abdominal wall that's almost this big. In the muscles, your muscles are spread out, and probably, you're right, it happened very early after the operation, you quote dehisced, and you've been living this way. And what happens over time is the muscles start to just relax out here. And they, and by the way, you have pretty good muscles, okay? You're right. What the other doctor said, your muscles are actually pretty decent. But they're over time, as they're living pushed out to the side, they don't come back to the middle so easy. You can't just go in there and sew it up. Right. You can't even sew it up is the point, even if you wanted to. But the point is it has a tendency to want to sit out here. Yeah. So you have a hole this big. So the modern treatment, to simplify it, of this hernia is all these different techniques we have that are basically separating the attachment of the rectus muscles, the rectus six-pack muscles, from these obliques on the side, separating them, not with a hole, but by stretching them out. Yeah. So stretching the muscles, ideally we need to get your muscles back to the middle. And yes, mesh is involved in the surgery. Dr. Fitzgerald put a certain mesh in, and he put it in for a very good reason at that time. But the reality is that that mesh is known to fail over time. It was safe to use, but not very durable. And I can't tell you what mesh I will use, but we're going to be picking a mesh that I'm going to think is, you're my responsibility, that is going to work and is going to be safe. And so that's a whole nother choice. And the mesh, that when we put in the mesh, it's within the muscle, not on the inside the way he did it. It's like within the sheath of the muscles, in the layers. So all of it is a much more modern way to do it, and I'm optimistic that eventually you'll live happily ever after. Your weight. There's two facts for you to help you understand why I'm not exaggerating and why you will be motivated enough, as hard as it is to lose weight, that you will lose weight. And one of the things is, let's just start with the obvious one. The obvious one is, you seem like a very bright guy. I've explained to you, you have a hole in your belly, the muscles are stuck out here, and if you try to, you can't even get them together. Well, one of the reasons why you can't get them together is not just that they're rigid out here, but this is not fluid. These are your intestines laden with fat. That's where all your weight is, in the blood supply to the intestine, and what's called the omentum. And that even if I did all those other fancy techniques where I separated those muscles, I wouldn't be able to put your intestines back in. Yeah. And if I did, I'd put your diaphragm up so much you wouldn't be able to breathe. Okay, that's really where the struggle. But right here, the way it's loose like that, that's all, getting back to that story, I don't think so. So it's absolutely impossible at your current weight, mechanically, with the best surgeon in the world, to fix this hernia. Absolutely impossible. Okay. So that's number one.
Can I?
Yeah.
Okay. After I had a heart attack, and went to Muma, and he fixed the last one. And at that last visit, I was sick. I felt great that next day. I couldn't believe how good I felt. I was telling them, and they were tickled about how the surgery went and everything. You know, my heart was doing so well. And I threw up when I got home that night. And I threw up nearly every day for close to 12 weeks. Never kept anything on my stomach because my food couldn't leave my stomach. It was blocked from going into my intestines.
And ultimately, that was the problem that Fitzgerald fixed.
Yeah.
Right?
And I lost weight. I lost a ton of weight. I lost a lot of muscle weight. I lost nothing on my stomach.
Okay, so you're saying you're afraid if you lose.
Then quantify that again. Then how much weight do you think you did lose?
At least 40 pounds.
40?
Yeah.
Okay. I'm hearing you again. I want to go back to the fact that it is impossible to fix you at your current weight.
That's what I thought.
Okay, it is impossible.
How am I supposed to lose this?
I'm going to help you with how you're going to lose it, and I heard what you had to say. And there's a little subjectivity there, so we'll get it. But the second thing, before we talk about how to lose the weight, is that in our world of hernia surgery, we don't have quite as much financial support or glamour as cancer research or heart disease research. That we don't have as much science. We're getting there now, but the only science we have about why hernias fail is very black and white in the literature, which is 100% true. Is weight and cigarette smoking. Yeah. You don't smoke, I'm sure. But weight and cigarette smoking. So like the other thing is I could show you literally calculators that show that it is impossible to fix you without killing you. Yeah. Okay? So the way you're gonna make this work is that you're gonna think about what we're saying because you're desperately motivated to get rid of this horrible problem that you have. And that's the biggest thing. It's not the way you look. She likes you no matter what. She loves you no matter what. It has nothing to do. Those are the reasons why diets fail, is because you just want to get into a smaller pan size, or my belly's a little big. And after a while, you forget about it. In this situation, if you really concentrate and actually amplify it by reading and find out that I am right, you should be 190 pounds to have this operation, you will lose the weight because of your understanding of what's necessary. So that's number one. Number two is how to lose the weight. And I'll get to what your other thing was. And there's a million diets, of course we know, but really there's only two main, if you really boil it down, there's really only two ways to lose weight these days, which is either a calorie-reduced diet or a low or no carbohydrate diet. Those are really the two options. The easier option, if you ask me, and you probably would agree with me, is the no carbohydrate option, because you can at least still eat. In fact, if you're prepared, if you have a life where you can prepare yourself shopping-wise and what's in your house and what's in your day, to be prepared with a no carbohydrate diet, you should never be hungry. Okay?
Actually, I've been on a carb diet for over 20 years. A low carb.
Well, when you say that, but then again, that's just words. If you truly are on a no carb or less than 10 grams a day, you wouldn't look like this, sir. Meaning, you say low carb, but you're probably taking in 40 or 50, which is enough that the fat you take in makes it turn into body fat. But at a level of, initially the diet is no carbs for 2 or 3 weeks, like zero. And the trick of both of these, by the way, calories and carbs, is to be honest with yourself and to be 100% accurate, which is not easy, especially with eating out and how much is the quantity and so on. But it is an exact science that if you have a zero carbohydrate diet for 2 or 3 weeks and then live on less than 20 grams, you will lose a pound every day, a pound every 2 days. You will. It is black and white. It's not, even though you think you're on it, there's some other carbs somewhere. Okay, so in the beginning, you can't even have a carb vegetable. Okay, so that's one thing. And then, as I say, you know, the good news about that is you can eat. You can eat fat, and this way you don't have to be hungry. But the hard part is if you're, you know, out somewhere, whatever, you know, rarely is there good protein anywhere. You know, proteins are more, and also it's more expensive because you have to have meat, fish, or chicken. You know, basically, or cheese. So that's one way, and then if you think that's not working, the other thing is calories. And the good news for you is you're tall, and you're not very old. We consider 66 very young. So with calories, the older you are, the shorter you are, the more female you are, the less calories you need. So that's why if you're a female and you're over 60 and you're around 5 foot tall, it's very difficult to control your weight.
Also.
Because you're not allowed to have, how tall are you?
I used to be 5 foot, so probably 4'11".
Okay, so unfortunately, and how old are you?
I'm 63.
So at your age, at your height, your body, this is an exact science, your body is only allowed to have, like from my recollection of all those charts, about 1,500 calories a day, which is almost nothing. So if you eat like less than a normal person and try to watch what you eat, which is about 2,000 calories a day, you're going to gain a pound every 2 or 3 months.
That's right.
And in order for you to lose weight, you have to be, you know, in the 1,000 calorie range, and then to maintain it about 1,500. So you're lucky because you're a man, you're tall, and you're not very old. So your calorie needs, I estimate, are probably around 2,200 calories a day. That means that if you went on as little as a 1,500 calorie a day diet, and again, you got to be exact and not be underestimating the calories, you will lose a pound every day or two. So that's a whole other option. Now that's harder, I think, because you're hungry. You know what I mean? It's not, you know, but if you can handle that, you know, one of the secrets to the calorie weight loss is to kind of divorce yourself from food. You're retired, you know, during the day. You know what I mean? Life is all about food is the problem for me and for most people. You know, where are we going to go have lunch? Where are we going to have dinner? Especially when you're retired, you know. So the trick for you would be to get a job or somehow get away from the food, and
stay at the pool,
and then save up the calories so you could have almost a normal dinner. This is how I run my life basically. I eat like less than 500 calories during the day, and I'll eat, you know, really around over 2,000 calorie dinner. You know, with a 2 glasses of wine, you know, 2,000 calories. And then a lot of people, old-fashioned things that you shouldn't listen to are, oh no, you have to have 5 small meals a day. That has nothing to do with anything, okay? That's certain people, yes, but that's not a fact. Oh, you need to have breakfast to speed up your metabolism. Old-fashioned, not true. If you don't need to have breakfast, if breakfast is your most important meal, by all means, have that as your big meal. But the point is that usually most people, you know, we like food, so we want to have a nice dinner. And you can save it up for dinner is the point. And then there's this whole world right now of what's called intermittent fasting and starvation, and you can do it that way. So, you know, that's really the only option is to really get crazy with a diet. And then, okay, so then I get you down to really under 200 pounds is your goal. And I can fix you and change your whole life. You know, it can be normal. You will get fixed.
Yeah.
And Dr. Fitzgerald can fix you. This wasn't about me operating on you.
Yeah.
I didn't say anything like that. It's not about who does it, but
Right.
that's really the key.
Yeah. Well, that's not what I wanted to hear, but that's what the life is, I guess.
And I need you to look it up. I need you. Well, you know what? The information on the internet's not that clear. So
I believe you.
But what I'm saying is that if you went to another hernia specialist, not surgeon, but a hernia specialist,
Yeah.
they would tell you the same thing.
Yeah, I believe you.
And it's not. And the other thing is that a lot of people think when they leave, it's not about me. It's not because it's hard, or people think, oh, there's fat in the waist. It has nothing to do with me. It's because it is impossible to get you through an operation at this weight, or even 25 pounds lighter is still going to be too much.
Yeah. Well, Fitzgerald said pretty much the same thing about me losing weight, but I still wasn't convinced that it wasn't a lot of fluid.
That's not fluid in there, and I know that because we have a CAT scan. I can tell you it's not.
I know,
fluid.
but
Us men put our fat in here as opposed to women outside the muscle. So between your skin and your muscle, there's about this much fat. Okay? But on the inside, you have your omentum, which is this fatty apron, is 4 times as thick as it should be with fat. The colon has fat around, and your small intestine has fat around the intestine and the blood supply, which could be a thin veil, like paper thin veil, is probably this thick with fat. Yeah. And that all takes up all this room in your abdomen where we can't close you.
Yeah.
And that's what you have to, that's what you can't suck out. You can't remove it. It's weight that has to be lost on its own.
Okay. The only other thing I had trouble with Atkins and stuff, it makes your kidneys hard.
It can affect your kidneys, but when you're going like this, what do you mean by that?
My kidneys?
Meaning a doctor told you had a kidney problem, or you're saying?
My kidneys were failing when I was in the hospital from a heart attack.
Okay, and you were on the Atkins diet at that time?
Well, yeah, I've been on Atkins for 15 years by then. But, and I never got to what they call, what is it?
Ketosis.
Ketosis.
Right.
I never got to ketosis.
Well, ketosis is really the true no carbohydrate.
Yeah.
And it's true, in rare circumstances, kidney failure can occur.
Yeah.
So so if you're really being that aggressive, it's not unreasonable to be, it doesn't make your kidneys hard, Sarah, is what I'm saying. It's nothing to do with what you'll feel or do it. It can literally hurt the kidney function.
Yeah. And
so, yes, if you're that aggressive and you're going to get into ketosis, it's true. A month after, someone should be drawing your blood and checking out your kidney function.
Yeah.
But it doesn't automatically cause kidney failure, no.
Okay. Because all the nurses just no, stay away from that.
Well, if you look at the real literature now, and even in people that were doubters, that in the true medical literature, that the most effective diet of all time is the Atkins diet.
Yeah.
In terms of weight loss.
I never lost much weight, but I did put on a lot of muscle.
I understand that, but at the same time, that I'm saying to you, you probably weren't really there. You didn't lose much weight. Meaning it's not about the book. I would go really on the internet to become an expert at what's in foods, okay? Yeah. And this diet would start with avoiding any carbohydrate. Like
that doctor on TV with the weight loss people, it's always no carbs.
So
no
none,
carbs.
Okay? And you will, after your first 2 days, lose 1 pound. And your 3rd day, you will lose another pound.
And it will fall off.
Otherwise, if you're not losing weight, you're taking in carbs. And then it's worse, because if you're someone who's taking in a lot of fat to compensate, and you take in just over that critical amount of carbs, you're not only going to not lose weight, you're going to gain weight. It's the synergism. So the only way the high-fat diet works is by having no carbs in the way to turn the fat into body fat. And without the carbs, you're burning that fat and getting rid of it.
Okay.
But I'm not telling you to do that. The whole other thing is the low calorie thing.
I know I could never go through that. Because I'm such a hog at eating.
But you can do it.
I know.
I had a patient lose 100 pounds for us. Many patients lose 100 pounds by not exercising and just counting their calories.
Wow.
And they were bigger than you are. I'm talking like 300 plus pounds.
Yeah.
So it's it's possible. You just gotta.
Yeah.
What else do you want to ask?
Well,
Is your medicines on another paper? Or you're on no medicines?
no, I'm
You're
on Plavix and the clopidogrel. What is that?
Metoprolol, that's
yeah.
it?
Not even metoprolol. Oh,
So you're on Plavix and lisinopril, that's it?
Yeah. Plavix, lisinopril, and what's the other one called?
Lipitor.
Yeah.
And Dr.
Muma,
Candace Nickel is your doctor.
PA, yeah.
Okay. Very good. You will get there.
All right, then. Operation ain't gonna happen this summer, is it?
There's no rush.
I know, but
There's no rush. The only rush is that if you're not going to do it, and you're going to live this way, the weight in your abdomen, which is where all your weight is continuing to push against your skin and push your muscles out further, making the situation worse over time.
yeah.
So that's the only urgency. You're not going to have an emergency with your hernia.
Okay.
All right?
Good
I'm
enough.
here if you need me.
All right.
What we'll say is I'll see you just for the fun of it in about 4 months.
Okay.
Okay? There's no time limit, just so I can be in touch with you.
An appointment with the lung specialist?
Oh yeah, with literally one of the doctors at, what do they call themselves? Lung specialists.
Yeah.
Isn't that what they call themselves?
Yeah, okay. For?
Shortness of breath.
Okay.
Yeah.
I try to get him in the pool where he can exercise, but his belly floats and it bothers him.
Yeah.
He's got an old one of those. I says, well, wear that old one of
Okay.
those in there.
Have you noticed your shortness of breath is worse with this, or you wearing the binder, or?
My shirt is what?
No.
No.
Your shortness of breath.
Oh,
When
sure.
you're short of breath
No,
when you walk.
it's better.
It's better what? With the binder on?
Yeah. Yeah. I was able to wash my truck last week. It's the first time in over a year.
Because sometimes people can have shortness of breath related to the binder.
Okay.
Because it's pushing up on your diaphragm.
Yeah, we would think with the binder it makes it worse. So that's why I think your shortness of breath really might be coming from something else.
Really? Okay.
I don't know for sure, but you really need to absolutely feel 100% confident that Dr. Muma doesn't think it's the heart and the lung doctor doesn't think it's the lungs, and then I'm satisfied.
And then weight loss will help is the point.
Right.
It's not the hernia, it's the weight.
That's very
Okay.
true.